National AIDS Secretary in Gambia joins the rest of the world to commemorate World AIDS Day on December 1st, 2022 at the Sadauda Conference Center. The theme for this year's celebration is to equalize, seeking to end stigma and discrimination among people living with HIV and AIDS. Speaking at the gathering, the Director of National AIDS Secretariat, Mr. Usman Baji, described the day as a reflection of the good work of people, including scientists, HIV and AIDS activists, health workers, and people living with the virus that has brought the fight against it over the last 40 years, and praises the Ministry of Health for their efforts.
We are happy that the Ministry of Health is about to launch an insurance scheme, and top on the benefit package for that insurance is the issues relating to HIV and AIDS. We are happy to have the Director of Health Services with us here, and they have definitely given due consideration to HIV and AIDS as far as the benefit package for the insurance scheme is concerned. As a country, we have made a commitment that by 2030, there will be no new cases of HIV and AIDS, no deaths caused by HIV and AIDS, and also no discrimination against people already living with HIV in the Gambia.
The representative of the Human Rights Commissioner, Mrs. Jiba, says reports from the United Nations, regional and national agency have raised concern with the number of new infections and related deaths, and is attributed to the series of human rights violations of vulnerable women and children, sex workers, to name few, contributing to the spread of the virus.
The violation of the fundamental principles of equality and non-discrimination and basic human rights and fundamental freedoms such as the right to health, freedom of association, access to information and right to privacy immensely contribute to the spread and impact of HIV. The violation of these rights creates multifaceted barriers in efforts to combat the epidemic, as they do not only limit persons living with HIV/AIDS and key vulnerable populations seek access to treatment services, but they also limit national efforts in ensuring efficient service provision.
Director of Health Services, Dr. Mustafa Bitey, also highlighted the key function played by his ministry.
As a country, we have made appreciable progress in the national response. For instance, we have sustained a low HIV mortality at 1.5%. We have also increased access to HIV and AIDS services throughout the country and introduced right policies, strategies, and standard models of care to help us accelerate implementation towards achieving the 1990 fast-track targets and eventually achieve epidemic control.
World AIDS Day is marked on December 1st every year since 1988 in raising awareness of the AIDS pandemic caused by the spread of HIV infection and among those who have died of the disease. For Gambia 24, I am Jenke Ture.